If you or someone you love has just been told that prostate cancer has spread to the bones, I know exactly what you are feeling right now. The terror, the confusion, and that overwhelming question, how much time do I have left? 3 months ago, my friend George got this exact diagnosis, and what happened next will completely change how you think about stage 4 prostate cancer. By the end of this video, you are going to know the 5 critical factors that determine whether men with bone metastases live 2 years or 10 years. You will understand the new treatment combinations that are keeping men active and pain-free for years longer than doctors thought possible just 5 years ago. And most importantly, I am going to show you exactly why the survival statistics you have been reading online do not apply to men diagnosed today. George was 58, a contractor who could still outwork men half his age, when his doctor delivered the news that made his world stop. Stage 4. Prostate cancer with bone metastases. But here is what his doctor did not tell him that day, and what most men never learn until it is too late. Here is what most men do not realize about stage 4 prostate cancer with bone metastases. The statistics you read online, the survival rates that doctors quote, they are based on old data and treatment methods that have been revolutionized in the past 5 years. The average length of survival after a new metastatic prostate cancer diagnosis is about 5 to 6 years, according to MD Anderson Cancer Center. But here is the critical piece that changes everything. This is not a death sentence, and the quality of life during treatment has improved dramatically. Let me tell you what happened to George and thousands of men like him who are living full, active lives with stage 4 prostate cancer. But first, we need to understand exactly what we are dealing with when cancer spreads to bones, because the more you know, the better you can advocate for yourself and make informed decisions about your care. The formation of secondary tumors at the bone is the most commonly observed site for the establishment of PCA metastases and is associated with reduced survival of patients, in addition to a cohort of life-debilitating symptoms, including mobility issues and chronic pain. This is the medical reality, but it is not the whole story. What the research also shows is that with proper treatment, many of these symptoms can be effectively managed, allowing men to maintain their independence and quality of life far longer than previously thought possible. When prostate cancer spreads to bones, it typically targets specific areas first. Bone pain, particularly in the pelvis, ribs, skull, and spine, are the most common symptoms men experience. But here is what surprised me during my research. Not every man experiences severe pain, and for those who do, there are now multiple treatment approaches that can provide significant relief. George started experiencing what he described as a deep ache in his lower back about 6 months before his diagnosis. He attributed it to 30 years of construction work, which is exactly what most men do. We normalize pain, we push through discomfort, and we assume that aching bones are just part of getting older. This assumption can cost us precious time in getting proper treatment. The breakthrough moment in George's journey came when his oncologist explained the new treatment approach called combination therapy. The first hit, standard androgen deprivation therapy with drugs like goserelin and leuprolide, suppresses the production of testosterone by the testes. The second hit is a newer class of drugs called androgen receptor pathway inhibitors, RPIs. These drugs, which include abiraterone, apalutamide, and others, work together to attack the cancer from multiple angles simultaneously. This is where conventional thinking about stage 4 prostate cancer gets turned upside down. For decades, doctors treated metastatic prostate cancer with hormone therapy alone, hoping to slow the progression. Now, we know that combining treatments from the beginning can significantly extend both survival and quality of life. The research supporting this approach has been so compelling that it has become the new standard of care at major cancer centers. But treatment is only part of the equation. What about the bone complications that George and other men fear most? The spread of the prostate cancer to the bones, bone metastases, can cause severe pain and fractures, bone breaks. Hormonal therapy for prostate cancer can also cause bone loss, fracture, creating a double challenge for men receiving treatment. Here is where the science gets really interesting. Bisphosphonates, pomidronate, and zoledronic acid, Zometa-R, strengthen your bones and work by slowing down bone cells called osteoclasts. These medications can prevent fractures, reduce bone pain, and actually strengthen the skeletal system while cancer treatment is working to control the disease. George started on zoledronic acid infusions every 4 weeks, combined with his hormone therapy and the newer targeted drugs. Within 3 months, his bone pain had decreased by about 70%, and his latest scans showed that the cancer progression had stopped. He is back to working part-time and recently took a fishing trip to Alaska that he had been planning for years. Now, I want to be completely transparent with you about working with healthcare providers and understanding that every man's situation is unique. This information is educational, and the treatment decisions you make should always be in close consultation with an oncology team that understands your specific medical history and circumstances. The 5 critical factors that determine outcomes for men with bone metastases from prostate cancer are more within your control than you might realize. First is early, aggressive treatment with combination therapy rather than waiting to see how single treatments work. The research shows that starting strong from the beginning leads to better long-term outcomes than stepping up treatments gradually. Second is bone protection with bisphosphonates or newer drugs called rank ligand inhibitors, which prevent skeletal complications before they occur. Think of this as preventive maintenance for your bones while the cancer treatment does its work. Third is comprehensive pain management that combines medications, physical therapy, and sometimes radiation therapy targeted at specific bone lesions. Pain medicines work to control the pain bone metastasis causes. You might take pain relievers you can get without a prescription or stronger prescription pain relievers. But the key is working with specialists who understand cancer-related bone pain specifically. Fourth is maintaining physical activity and muscle strength through appropriate exercise programs designed for men with bone metastases. This might sound counterintuitive when you are dealing with bone cancer, but supervised exercise actually helps prevent fractures, reduces pain, and maintains the quality of life that keeps men independent and active. Fifth is staying current with evolving treatments because this field is advancing rapidly. New immunotherapy approaches, targeted radiation techniques, and combination drug protocols are being refined constantly, which means that the treatment landscape continues to improve for men diagnosed today, compared to even 2 years ago. What does this mean for your health journey if you or someone you care about is facing this diagnosis? The statistics that show the 5-year relative survival rate for distant, metastatic prostate cancer is about 34% to 50%, are based on large populations and older treatment protocols. Individual outcomes can be significantly better, especially for men who receive current combination therapies and comprehensive bone care. George's oncologist told him something that changed his entire perspective on living with stage 4 prostate cancer. She said, "We are not trying to cure this disease right now. We are turning it into a chronic condition that you can manage while living a full life." That reframe from terminal illness to manageable chronic condition has allowed George to focus on living well rather than preparing to die. The most important thing I learned through George's experience is that stage 4 prostate cancer with bone metastases is not the same disease it was 10 years ago. Treatment options are more effective, side effects are more manageable, and men are living longer, healthier lives than previous generations with this diagnosis. Your next step toward understanding your options is simple. If you are dealing with this diagnosis personally, or supporting someone who is, start by asking your oncology team about combination therapy protocols and bone protection strategies. Get a second opinion from a major cancer center if you have not already. And most importantly, remember that the journey ahead, while challenging, is not hopeless. Here's what I want to know from you. What is your biggest concern about prostate cancer and bone health? Are you worried about pain management, treatment options, or maintaining your independence? Share your thoughts in the comments, because your questions help me understand what topics to cover next for the Strong Roots community. If this information helped you understand stage 4 prostate cancer better, subscribe to Strong Roots and hit the notification bell. I am tracking several new treatment studies that could change the landscape even further for men our age. And I want to make sure you get those updates as soon as they become available. In the next video, I will be covering prostate removal surgery and what they do not tell you about the recovery process, so make sure you are subscribed to get that critical information.